restaurants, and our presenting sponsor, Comcast. Seattle City Club's mission is to inform, connect, and engage the public to strengthen the civic health of this region. And speaking of engaging, remember there's an option on your screen that allows you, the audience, to submit questions. Our guests this evening are three people who know a lot about coronavirus and its impacts. King County Executive Dow Constantine, Patty Hayes, she's the Director of Public Health for Seattle and King County, and businessman and restaurateur Tom Douglas. For the first 30 minutes tonight, I will be talking with Executive Constantine and Tom Douglas, and then we switch gears, we say goodbye to Tom, and have Patty Hayes join the conversation. So audience, raise your own glass of whatever you have on hand, and let's begin. I will start with you, Mr. County Executive. Since your office oversees public health in our region, the big question is how long? How long will our lives be so strange? Our president, as you know, a lot of folks know this, earlier mentioned churches filled by Easter. He has now taken that back and now extended guidelines and warnings until the end of April. Bill Gates, he's a King County resident, recently told CNN we may need 6 to 10 weeks of hardcore isolation nationwide. Dow Constantine, what are your best advisors saying about this? What is realistic?
Well, my best advisors are cautious, but realistically, the end of April for sure, and probably considerably longer. I mean, you have to watch the trends day to day, and even as you start to bit by bit reopen our society, you have to be very careful not to allow the virus to reemerge, the epidemic to reemerge. So I cannot say right now when we will be back to when the restrictions will be lifted entirely, but I think Mr. Gates has proved fairly far-sighted in this in the past, and I don't think his estimates are far off.
Do you think 6 to 10 weeks is from now or from when we first began doing this?
Well, I can't answer that. I can say that it will probably be more than just the month of April, but you know, we have to begin figuring out how we can get some things back to normal. You can stop many services for a week or 2 weeks or maybe even longer, but there's just ordinary things that have to happen. Cars need to get maintained and people need to get their hair cut, and it all may seem kind of trivial one by one, but it is going to have to, something's going to have to give, and that is not going back to doing things normally. That's figuring out how things can be done safely, and that's a big task for a free society, and it's going to have to be done very carefully, because the most important thing is to stop the disease from spreading.
Well, tell us that little bit of good news. If there is any, you know, King County is making some progress. Saw you earlier on the networks. Social distancing works a little bit, and we're actually bending the curve in King County, although the numbers have been slow to arrive in the last day or two. So what's the good news?
Well, first of all, yeah, you can't put a lot of stock in sort of day-to-day changes because the data is so lumpy. More tests are administered one day or more are processed another day. The good news over time, though, in King County is that we are right now in the period when we expect exponential growth in infections, and we're simply not seeing that. We're seeing an increase. We're seeing every day another roughly 150 positive tests come back, and we're seeing 5 or 10 or even more fatalities. And those are all folks who were infected weeks ago. But the fact is that we seem to, through our determined and early actions, and really community-wide actions, found a way to start driving down those increases. One interesting way of measuring it is the time it takes for infections in the community to double. Nationally, the number is something on the order of 3 days. Every 3 days, we're seeing a doubling.
We've on that. We have.
Yeah. Here in King County, it is more like 10 days now. And that is a very good sign. And I also watch the percentage of each day's tests that come back positive. And it has really stayed within a range from about 7 to 13% over time. I would be very concerned if we suddenly saw a spike in the percentage of tests, whatever the sample size is, that are positive. So it's all very rough. We're still mostly flying blind because of the federal government's failures on getting adequate testing out there. But there's no question that however you end up being able to measure it, we are having an impact.
Tom Douglas, the business impact of this epidemic is staggering. Your restaurants are largely closed. What will the economic impact be, if you can even tell? And how long do you think it will take to bring some or all of them back, if you're planning that?
Well, the economic impact is obvious. It is 100% unemployed in our company, 150 people on the unemployment rolls. Folks are trying their best to get by, but from that perspective, I have no idea when this is going to stop. I don't think anyone does, and I'm hopeful sooner than later that we will come back as a different company, but come back to the job.
12 or 13 restaurants right from the start. Dahlia Bakery is still open. I was looking at that. But two questions about that. Why didn't you go the takeout route that some of the other restaurants did? And what was your whole decision about this? Like, you know, like a business management thing. How did you decide we are just shutting down system wide?
It's a little bit different than the neighborhoods. We definitely had to make a choice sooner than later than, say, Ballard did, because of tourism being 50% of our business downtown. And so it wasn't an option. Our teams had already bled their incomes long before we shut down. So it was a tragic situation. We just didn't have a choice. When it comes to go, I had these questions like, why didn't you open a bagel shop like Camless? You know, the Camless.
Oh, you can't open a bagel shop.
Well, I'm just saying the Camless team did an incredible job. They're in a different situation than we are, and so it just wasn't possible. And I think that what people don't recognize is how important it was to me to have our team work and get paid and get out with their benefits and get out with their vacation pay and literally do everything that we needed to do to keep them whole. They didn't work 1 hour or 1 minute that they weren't paid for. Unlike some of the restaurants that are shutting down now, we can't make the payroll. So it is that was an important criteria for me.
I think. Dow Constantine, the most troubling scenario that anybody, we do have some feedback issues, I guess. The most troubling scenario would be for all the different cities and for us as well, would be a surge in cases that overwhelm hospitals and medical staff. You know, we were very worried about that maybe a week or two ago. I think we should still be worried about it because, as we know, the peak hasn't even come yet. The peak is supposed to be, what is it, mid-April, April 19, 24. I've seen all these different dates. But from what you know now, can you tell us, do you know that we have enough space? Like right now, there's enough space in the intensive care units, and there's enough medical staff. But do you think that will still be true throughout April, from what you know now? And I realize that's a little crystal ball-y, and I'm sorry about that. Yeah.
I don't know. We don't know. And that's why we started way back in January preparing to have surge space, to have space for people who don't need the intensive care of a hospital, but need some level of medical care. So we have isolation and quarantine beds that we're setting up all around the county. We have assessment and recovery centers like the large tents that you've seen on the news in Shoreline. Right now, we have about 750 beds up and ready to go. We have hundreds more coming online. We want ultimately to try for several thousand. But
yeah, your staff said 3,000. We're right.
Yeah, and the goal is obviously not to have to use all of those because the first line of defense is prevention. And the more we do on prevention, the less the crowding in the hospitals will be, the less need we'll have for these other facilities. And also, to your point about when the peak will be, the more we do on prevention, the later the peak
It slows
happens,
it,
as well as it being lower. The whole game here, and you've seen this in Italy where they've had this tragic overflow of
Italy,
hospital
yes. It breaks
capacity.
your heart. Breaks your heart.
Yeah, and we just cannot accept that. We cannot accept that there'll be a certain number of infections, a certain number of deaths, that hospitals will at some point be overcrowded. We have to throw everything we have at preventing that scenario, because we all, 2.3 million of us are in this together. And so that has really been our goal. First, prevent, but then do everything we can to avoid the situation when you run out of hospital beds, you run out of ventilators, you run out of qualified doctors, and people are left without the care they need to save their lives.
So I'm going to come back to some of the locations for the overflow, very important. But while Tom was with us, Tom, you and I have had a conversation a couple times about sort of the future of downtown Seattle. It's a success story, but well before coronavirus, we were worried about the health of downtown. So just a few notes on why it's hard to do business in the city now and when we come back.
Well, it's been an interesting time for the last 5 years about doing business in our town. It is, when I first started opening restaurants 30 years ago, I was a hero. I was opening businesses in places that nobody else wanted to, that were tough places to do business in downtown. We were bringing life to neighborhoods. We were doing all sorts of things that people cherished. In the last 5 years, the situation has changed, where business people have become the enemy.
How are you the enemy? How is someone like you the enemy?
I don't know. I don't get it. But
no, but I mean,
we're looked at by our current city council as...
Well, our current city council is a little strange sometimes, yes.
But I'm just saying, we're not appreciated as like we were 30 years ago for bringing life and energy and jobs to downtown Seattle. And that is why I'm saying that it's just different. But I'm looking ahead, and I'm also thinking that,
there will be a desire to have a lively downtown. And when we come back, and, we're not able to really pinpoint that date, but when we come back, don't you think people will have been in their houses enough? They'll want to really get out there and do stuff, right?
I'm kind of using with my friends. I've gotten calls from all over the country because everyone's dealing with what we've been dealing with for the last month. And I just use kind of the idea of like, when are you willing to travel to Wuhan? When are you willing to book that flight, travel?
It is the flight.
The markets?
Yes.
Well, I'm just saying that's a good barometer to me of when to expect business to come back to our town.
But don't you think the city will welcome you and many of the other places because they've been away for so long for that?
I'm not sure you really get it, Joni. It's not like that. It's different now. You don't just come back from this. This cost $3 million just to close my businesses down. Yikes. We are broke. I'm not sure you don't just like, okay, I'm going to open 13 restaurants. It's like, it just doesn't work that way. And so you're asking a question that's untenable. And it is, I hate to force reality on people, but the reality is that it's going to be tough to come back. It's going to be tough for 50% of our restaurants to come back. And so that's just the way it is. And I'm looking towards the future. Like, we're opening a to-go business in Ballard on April 8th.
Okay.
We're serious. We're starting. We went from 850 employees to 5.
Oh my.
And we are starting from the ground up to create a new future, a new business, a new model. And the rules changed while we were in business, right? Over the last 5 years, the rules have changed. Now we have to build a business based on the new rules that our city council has put in place. And that's fine, but it is different.
Okay, so let's talk about the fact that people aren't really traveling. You're right about that. The hotels are empty. In some cities around the country, the hotels are providing beds for doctors and nurses. Sometimes you have to bring some of the medical staff in from out of town. So Dow Constantine, has King County done what some of these other cities and counties have done, arranged for hotels to kind of host some of the frontline workers who are coming in town, out of town, or they're from the suburbs. Many of these hotel rooms, as we're saying, nobody's traveling, so the rooms are just sitting. What about that?
Yes, we've been working with our health industry partners, and we've had great partnerships with organizations like Kaiser Permanente to make sure that there's space for the personnel who are coming in from out of town. Of course, now that this is nationwide, those same personnel are needed everywhere. But also we have been able to buy or lease hotels for people who are either in isolation or quarantine, people who need to get out of the congregate setting they're in cities all over the region. And that is helping some of the hoteliers have enough income to avoid complete catastrophe, but it's also providing the space we need to reduce the rate of infection. There was one other thing I want to mention on the rate of infection. A recent study showed that the number of people infected by the average person who had contracted coronavirus had declined. And I just want to read you the exact statistics from 2.7 people per person in late February to only 1.4 by March 18th.
So
that
that's
is the exact result of the social distancing, avoiding infecting people, and that is what's producing the results we were talking about earlier.
Tom Douglas, a lot of small business relief is supposedly on the way from the state and the federal government, even some local money available. You run a large group of restaurants. They're clearly, having a very hard time like everyone else here. Do you get some of the relief?
We're hoping so. We're going to start applying on Friday when the CARE Act applications are available. We will see what that does. We're in a funny position. We are a group of maybe 16 different businesses, small businesses, but that are grouped together because of similar ownership.
Yes.
And so the city council in our town considers us and looks at us in exactly the same light as they do Amazon or Boeing or Microsoft, because we have over 500 workers. So we're not really sure what we are able to work with, right?
So, if you get some relief, how do you plan to use it?
Well, I would love to reopen some of our joints. I mean, that is just, you got to remember, when you have to reopen, you have to hire, train, re-inventory, make your leases whole. There's a whole list of things.
Doesn't some of your staff want to come back?
I hope so. They're awesome people. And we try to be an awesome employer. It is just, we'll have to see.
I see. Dow Constantine, I wanted to ask you about the Army Field Hospital at Century Field Event Center. Mm-hmm. How to tell folks how that project, and I don't know the exact opening date of that either, but when that comes online, you see everybody down there working, they're clearly building it. How will that ease the projected crunch that we keep talking about here?
Well, it'll ease it by 148 people. And more than that, it will ensure that if you have a health issue that is not COVID, that you'll have somewhere you can go for sure. The federal government originally promised us a large, I think over 700 bed, fully equipped and staffed field hospital, 2 of them, I think, for the state. It got whittled down to this 148 bed unit, which we're very happy to have, but it is not going to be added to the need. And I'm glad at it, and I'm glad that CenturyLink willing to turn over that space for the purpose that is really ideally suited. So you can be confident that if you have something happen, you're going to be able to get care, even if you don't happen to have come down with coronavirus and COVID.
Well, so what services
I don't know the
provide? Do you know what services will they provide? I mean, you need a preventative care or something like that. Can you go?
No, this is a full
kind of emergency.
This is a full hospital. So clearly, Harborview remains the region's trauma care center. If you have a bad car crash or a head injury or some kind of major trauma, you are going to go to Harborview. They have segregated out the space that's for the COVID patients. You'll know if you go up there that you enter off of 9th Avenue and not the emergency room entrance on the side, and they have a sort of pre-screening tent set up there. But you will be able to go to Harborview Hospital, and this hospital at CenturyLink is intended for people, again, who have a serious enough condition to have to be hospitalized, but they're not going through the COVID. Of course, they'll be screened to see if they have coronavirus, but they're not going through the COVID-19 protocols. And it is one of the many ways in which we're seeking to respond to this imperative to avoid having our hospitals overwhelmed and having people turned away who desperately need care for respiratory symptoms.
Timing is everything, Tom Douglas. Will the federal, state, and local relief arrive in time for smaller operations, your fellow restaurateurs and small businesses that run on pretty tight margins?
I sure hope so. You know, and so many of them, and Dow, you too, are doing such incredible work to kind of keep the lights on. We have our own little pilot light team trying to keep things lit in order to revive ourselves as efficiently as possible. But if you look at Eduardo up at Solare, you look at so many people around Seattle, restaurateurs that are trying their best to feed hospital workers, to feed the food banks. You know, I know we raised 52 grand because of the generosity of our neighbors last weekend at a salmon bake for Food Lifeline. I mean, there's restaurateurs all over this town that are working hard to help this town survive and then come back strong. You know, whether it's feeding the fire department or the Ballard Hospital or whatever it is, I'm super proud of our industry for stepping up and being part of the solution.
I'm glad you brought that up. So similar to like the idea of the hotels, the restaurants are doing meals for all different segments of the population that are working on this or that are harmed by it.
And I would say that we could do more. We're starting to see some organization happen to the funds for people to get 3 meals a day, every day, senior centers, child care centers.
Who's providing those that you're talking about?
They're starting to come online now. I just talked with Howard Schultz in the last couple of days. He's starting a fund for our restaurant workers. There's all sorts. The James Beard Foundation, National Restaurant Association. I mean, there's things are really starting to gel around the future and where we're going and what needs to happen to get there.
Executive Constantine, I wanted to ask you, you were sort of hinting, or maybe maybe I'm reading too much into it, but you said that we were supposed to get 2 field hospitals, maybe now we might not be. And I read something similar about ventilators. There were some that there was this extra number that we were supposed to get, and now maybe not. So my concern there, or question anyway, is some of our success maybe even harming us, you know, in terms of how the federal response might be?
Well, I can't answer that question. From the beginning of this, it's been clear that we're mostly on our own here. And we are not in a position to stop and wait and have a staring contest with the federal government to see if they're going to blink and give us the things we need.
Yeah, that's not helpful.
It's true of hospitals. It's true of test kits. It's true of ventilators. It's true of personal protection equipment. It's true of all of it. And we will take what we can get from them, but we're not going to sit around depending on them, because the peak of this thing will arrive and we won't be ready. And I'm sorry to have to say that, but this has really revealed the sort of failure over decades of the national government to build the infrastructure and prepare the institutions that will protect the people of the United States of America.
Tom Douglas, I wanted to ask you about some of the restaurants that are doing takeout. Does this work financially for all restaurants? In other words, just my impression is you need people in seats, or you need people buying drinks. You know, can you actually make money with takeout?
Well, we're going to find out. We open April 8th here at our warehouse in Ballard, and we're going to find out if it works. We tried it in the core, right where we're situated downtown, and it was tough. There's just nobody there. And the neighborhoods are much more viable, it seems to me, because people
so
just
it's
aren't
easier
going
to do in a
downtown.
neighborhood. That's very
Yeah,
interesting.
so we're going to do that.
Makes sense.
And I would be remiss, I know I don't have much longer on here, but I want to
Tell
put a
us what
plug
you
in
want
for
to tell
Food
us.
Lifeline, the most efficient hunger relief organization in our state. Every dollar is either 16 pounds of food or 5 meals. So if you're looking for a place to help, Food Lifeline is the spot, as far as I'm concerned.
You've worked with them for a long time.
Almost 40 years. And I got to say, I'm so impressed with them. They're first responders. They're there in thick and thin. And the organization is fantastic. They supply, by the way, they're a food bank distributor. They supply every food bank and meal program in Western Washington. So it's a great place to spread your cash around.
I want to ask you, before you go, I want to ask you this. What is your best new for you for takeout, or for you, Tom Douglas, or for anything, sort of how you're handling this crisis, that your personal etiquette / how to survive Corona behavior that you think is really like protecting you?
Protecting me?
Well, yes.
So I'm not worried about me. I have 850 people that I just had to lay off that are out there struggling to make rent, feed their kids, pay their bills. I am sick about that. And I frankly, I'm not worried about me. I've been here, done this, but my teams are hurting, and that makes me crazy.
I see. Dow Constantine, I wanted to ask you about something you posted on your personal Facebook page. This is going to see, maybe this is from too long ago, but I want to read it if it's okay.
Sure.
I'm about ready to only order groceries delivered or shop where I can pick them up curbside, because for some apparently psychological reason, people can't help but stand too close to each other. You've noticed this everywhere. And in the checkout line. The same is true for people queued up outside restaurants for pickup orders. Why? Just stay back. And 6 feet is just the minimum. Try 10. 10? Do you know something we don't know?
No, but I do know 6 feet's just the minimum. And it's funny because I wrote that, and it's intended to be kind of in jest. But after that, I went to our local supermarket, which is doing a great job, the Metropolitan Market up the street here, of providing real clear signage, lines you have to stand behind, put your stuff on the belt, and step back so the checker can step forward. And I do that, and I step back and stand in my line. And the woman behind me comes walking up with her stuff, past her mark on the floor, right behind me. I can basically feel her breath in the back of me.
Breath, not a good thing.
And I'm looking at her, and the checker's looking at her, and she's completely oblivious. And I just kind of walk away into the cheese department for a while the checker rings things up. People got to pay some attention here. It is not okay to be doing that to your neighbors. And I do think that I just wanted to return, though, to some of Tom's points. He's not concerned about himself. He is concerned about his employees, and that's important. I'm also concerned about his places. I'm concerned about the institutions. I'm concerned about the kind of community we're going to return to when this is over. Our restaurants are on the ropes, the bars and the clubs and the cultural institutions, all of the places where we gather together to enjoy being a community, where we exchange ideas and the places that make life worth living. We have to direct the federal aid, what state aid we can, local efforts to help get all of those institutions through this and back on their feet. Now, Tom's right. There's so much disruption. It's so dramatic. Clearly, things are going to look a lot different, but we don't want to live in a community that doesn't have that richness of shared experience. It would be a terrible loss for us to come out of this and not at least try to preserve what we so much enjoyed about our cities and our region.
Well, thank you. Moving along, we now say thanks as always to Tom Douglas for being such a great host to Civic Cocktail. You were awesome to us there in the Palace Ballroom and being a terrific guest on this show. So thanks, Tom.
Thank you for having me, Joni.
Thank
Bye,
you.
Dow.
Hope to see you soon. Virtual Civic Cocktail now welcomes, and let's hope this shuffle works, Patty Hayes, the Director of Seattle and King County Public Health. Executive Constantine will stay with us, and we will have time for your questions at the end of this segment. Is Patty with us? All right.
There's the camera.
Here we go. We're having fun here. Rocking along on an April Fool's evening. It's actually really gorgeous.
All right. And did I show up?
I don't see you, but I might just start talking anyway. How's that sound?
Okay. Ask him what to do. I've got the
He's not
microphone.
showing up. What do we do?
Okay, should I keep talking to Dow? I got lots to say to Dow. We didn't get to his hotels yet, his motels.
Mm-hmm. Let's do that.
Okay, so Dow, earlier on, we were talking about how we need this space for quarantining and isolation and recovery. And early on, that first weekend, you, right out of the gate, you bought a motel in Kent. Mm-hmm. And so I wonder about that. There was a little kerfuffle, let's say, with the first guest of that motel. Mm-hmm. Checked out the next morning. I don't know if she checked out, went and stole a few things from a convenience store, got on a bus. At first, it was thought that this person was positive, but I guess later it turned out negative. How do you keep people who come to these places, how do you keep these people there for their own protection and the protection of the community?
Well, we have a motel in Kent, we have a hotel in Issaquah. We're acquiring several others in cities all around the county. And the idea is to provide space for those who can't isolate or quarantine at home, either because they don't have a home or because they have vulnerable people in their home and can't be separated enough, a place for them to be until they are no longer contagious. And we bought the Kent property, which we had been pursuing long before the Life Care Center situation unfolded. And in fact, we've been pursuing several of these properties over the course of the month of February. And it is very good because it has individual rooms, each with their own air conditioning and heat, each with an outside door. So if you are infected, you're not going to infect the person next door who might not be. We moved one person in. He, after several days, left. He was not positive, but he did steal a donut at the mini mart across the street. That was apparently cause to hold a press conference. We subsequently have had several people in there. We're continuing to move folks in from various communities who need a place to rest and convalesce. We bring them 3 meals a day from Fair Start, as well as snacks, things to keep them entertained. Alaska Airlines very kindly donated more than 300 of those digital players that you see on the airplane, fully loaded with games, movies, and television. So we can hand those out to folks to help them while away the hours while they wait until what our public health officers determined to be 3 days after the symptoms have subsided for them to be able to leave.
So the other thing, and we touched on this just a little bit, but I wanted to kind of expand it. So you have specified places for these folks who are recovering, quarantining, isolating, 750 spaces, and the goal is 3,000, including you have a location also on a soccer field, right? So where how do you get from the 750 that you've identified all the way to the 3,000 that was mentioned by your staff last week?
Yeah. You know? Well, the 750 are only those that are complete or nearly complete. There are a whole bunch of other that are in the process, including that we are around. Some of this is for what the mayor and I have been referring to as de-intensifying shelters to reduce the chance of an infection happening in that congregate setting and spreading. Some of it is for isolation and quarantine, some of it is for assessment. But the goal is to get to that number a number hopefully we will never have to fully utilize in order for us to have real assurance that we're not going to overwhelm the hospitals. I want to say that our public health officer, Jeff Duchin, a couple days ago issued an order that requires you, it is a directive with respect to quarantine. So if you have symptoms and you've been tested, you are directed to stay inside, stay in your home or a place that we designate until you get the results back. If it's positive, you are ordered to isolate.
And it said but then
until your symptoms are gone for 3 days.
It said this will, I saw the order and it said folks will face enforcement action. Mm-hmm. But what is the,
in an extreme case, remember, most people are going to have the sense and have the capacity to shelter in their home. They're going to have the wherewithal, the resources to get the things they need. For those who are not able to, we're providing really pretty nice facilities and services. And we are assuming, and I think it's true, that most people will simply stay. For those who don't, we will, of course, chase them down and inform them that they're going to end up being subject to being detained involuntarily. And if they persist in putting others at risk, we really have no choice but to go to court and to get an order to detain them. We've had to do this periodically in the past with people who have diseases like hepatitis, but the fact is that most people will comply because most people, even if they don't have a strong sense of civic responsibility, don't want to be arrested.
So I don't envy you folks, public officials, because whatever you say, it can affect what happens next. And so here's an example. King County numbers, as we said, are beginning to round, beginning to soften from a terrifying upward curve. The fear, of course, is that people will relax behavior. I have a friend at the National Institutes of Health, and just talking among ourselves, there's some fear of a scenario where young people in particular tire of the restrictions and begin to behave more recklessly. How do you folks in government keep that pressure on? It's a long period of time, as we've been saying all evening.
I mean, that is a good sort of sociological question. How do you influence those who feel like they're not at risk to behave in a way that is protective of the entire community? One of the main lines of appeal is appealing to them about their parents and their grandparents, about protecting those who can't protect themselves. And I think that is pretty effective for a large proportion of the population. Prohibiting gatherings was important because a lot of younger people were simply continuing to gather and creating a situation where the virus would spread and ultimately reach those who are less able to fight it. And we're going to continue prohibiting gatherings, which goes against everything you and I have learned our entire lives about the right to assemble and about our civil liberties. But the fact is that if we don't do that, we're going to end up with a reemergence, a reacceleration of this trend that we've been fighting so hard to dampen, and we just are not going to stand for that.
So if it's true that we have to isolate for 6 to 10 weeks, we have a lot of time to go. We do. How about some of the rules of the road? And I mean literally on that. The stranger has been talking about using the roads more in some organized way rather than the disorganized way for bikes and walking. Have you given any consideration to that?
I mean, I think that those are valid ideas because there's a real great variance in people's access to outdoor recreation. In my sort of single-family West Seattle neighborhood, you can walk, and people are walking without getting too close to anyone else. You can go out and sightsee, ride your bike. It's fine. We have kept access to our parks available even though the parks are closed because there are many places where people don't have a backyard to hang out in or streets they can really wander around on. They need a park to go to, but we have to make sure that they're being safe there. I think that idea of converting some underused streets to safe pedestrian and bicycle use has a lot of merit, but it needs to be safe. People cannot be gathering the way they used to, despite all our impulses to be with others. People have to really relearn those habits.
Do you have any sort of suggestions for folks? So, I'm a runner, I'm in Stewart Park all the time, and we all seem to be doing, well, some days are better than others in terms of dividing the path. We all want, you had said 10 feet, 6 feet, 10 feet, something like that. But sometimes you'll see people just having a good old time walking down the middle of the path. And, I even had one day, I was off to the side of the path and a woman was sort of motioning me, hey, move over. But if I moved over anymore, I was going to be in Lake Washington. It's a little chilly outside. So I just stopped. I didn't want to get in, have an issue. I just wanted to be safe. So what about that part of the jostling out there?
I mean, we're all learning new ways to keep appropriate space around us. Those people are close talkers and you want to ask them to back up, but you're too polite. Well, now you have license to do it. And the definition of close talker has changed dramatically in the last month. So I'm finding people, I try to say it politely, but if people are just being knuckleheads, then you can be fairly direct in getting them to back off. I really have to continue to emphasize that just because we seem to be making progress on the numbers is no reason to let up. In fact, it is confirmation that these strategies work and a good reason to intensify them, to do everything you can to prevent the spread of disease, to drive down the transmission rate, and to get us through this thing with the fewest possible people becoming infected and the fewest possible people losing their lives. It is really a life and death issue. It is not for anyone, even those who are less vulnerable, to take lightly.
I'm told that,
this is Josh from Town Hall. I'm just stepping in just really quick. Sorry, we've been having some technical issues with Patty Hayes, but Patty is here now. Her video is not working, so if you want to include her in the conversation, you can.
I do desperately want to include
Okay,
her.
so go ahead and do that.
It's on live radio. Patty's on the line, but
yes, but we can't see her. So
that's great.
Patty, do you want to just say hi really fast?
Hi. What a bummer.
Hi.
I think my computer has coronavirus.
Oh my. Well, my internet does. So, well, now that you're here, we got to make the most of the time. But let's pick up with the conversation about masks, because you and I were speaking of this in a pre-meeting. We all understand the need to preserve masks because they're needed more by medical professionals than, imagine the math on that. 300 million people using masks. Okay, we wouldn't have enough. But there have been a couple articles, one of which you sent to me, I think it was today or yesterday, saying that these sort of bandanas and makeshift covers might not be the worst thing. Is there any science on that? You called this science in real time.
Yeah, thanks, Joni. That's really true. I think we are discovering science in real time through this, because that's why it's called a novel coronavirus. It's new, and we're looking at the behavior and trying to learn. In the latest studies and article that I sent you, clearly that we're learning from what China did, and what they're starting to say is, in addition to the most important thing, which is staying apart, as Dow's been emphasizing so well, we know now that we want to preserve masks that are medical grade for our healthcare professionals. We know that if somebody has a cold, wearing a mask so that you're protecting yourself from other people. If you have coronavirus, we don't want you going out, mask or not, you stay home. But if you have a cold, that can protect other people. If you want to wear a mask out of doors, a homemade mask or something is what is being looked at. CDC doesn't recommend it, but doesn't urge against it. So we're kind of in the middle of this.
I think people would do it if they thought it could be at all helpful, would be the thinking of it.
Well, clearly, if someone is outside and they're coughing, I have a lot of allergies. So sometimes I worry when I'm outside and I'm starting coughing that,
oh, no one's going to talk to you or
I
look
would
at you.
freak out people. Right. So, maybe it would be good for me to start wearing a mask outside just so that I don't worry people if I'm coughing. So the science is emerging, I would say. It's not that CDC recommends against it. It's just there's no evidence out in the open when we're pretty far apart and we are doing what we need to do for physical distancing, that it actually has science benefit.
I see. Okay, well, now I'm going to give you a weird question, Patty, because you took too long to get you on the line here, I think. My son-in-law is a chemist and a medical researcher, and he and I have been talking about this, and we were wondering, and no one has mentioned this, and so this is just out of left field, perhaps, but are folks who have coronavirus able to emit a sort of a viral plume? In other words, a jogger going by, a bike rider, people next to you at the store. So the question is, does the virus actually hang in the air for a period of time?
Right. So that's a very good question, and I'm happy to clarify it. So the science right now is that coronavirus is not like measles. Measles does what you're talking about. It can hang in the air. Coronavirus is a droplet. So it's exposure to the droplets or the hard surfaces like your cell phone that could have that droplet land on it, and the virus can still be active for a while on that hard surface. But it's not like a plume, it's droplets.
It's not like you're walking into this plume of stuff. I see. Dow Constantine, when we were talking here a couple minutes ago, you mentioned West Seattle. The West Seattle Bridge is closed. There's two schools of thought on this, and maybe there's three. I'll just offer two. This could be the best time for this to happen if it has to happen, because the roads aren't that busy. Or folks in West Seattle, and I think we have two of them as part of our panel here today, could be, really worried about getting emergency needs taken care of. So which one?
Or both.
Or both.
I mean, three, this is all part of a vast conspiracy to keep us from traveling during the epidemic, which is like the first thing I saw online after the mayor announced that the bridge was going to be closed. I cannot believe that the bridge is shut down completely for the second time in my life. You'll remember when an intoxicated ship's pilot ran into the old bridge.
And then we needed Senator Warren Magnuson to fix it.
Yeah, and that took 6 years. It was right after I got my driver's license, and it was one hell of a mess. This hopefully will take less time, but right now they're reserving the low-level bridge, the swing bridge, for emergency vehicles and buses during busy times, of which there have been none so far, but they're giving them priority. It is a huge pain in the neck. It is a worry for me. I have elderly parents. I have a young child. I want to be able to get to the hospitals, particularly Harborview, in a hurry if I need to. We are working for when the economy starts coming back. We're working hard to make sure we have significantly increased transit options, increased water taxi service, increased bus service that uses dedicated routes to make sure people, the 80,000 of us who live on this peninsula, have a way to get out of here without driving most of the way to White Center, turn around, and come back. It is enormous inconvenience, and if you've tried to get across the first South Bridge, even with the West Seattle Bridge functioning during rush hour, you know that that's not a realistic plan for us.
But we don't have rush hour anymore.
We're going to be in for it for a while.
Do we have rush hour anymore?
Not right now, thankfully. That's what I'm saying about them not having to really block the bridge from auto traffic right now, but they will have to. When things start getting more like normal, if the upper bridge isn't open, they're going to have to send off a lot of us down miles and miles to the south to find another bridge to cross before we can come back north into downtown.
So I'm going to bring a few of our audience questions as promised into this discussion. And this one is directed at Patty. What long-term changes, if any, do you see to our public health system as a result of the pandemic?
Well, I'm hoping that, number one, our public health system comes out of this stronger, and that the long-term problem with underfunding will be surfaced so that we will be able to regroup and get back to the work we're supposed to be doing for the community and helping all community members with their health. I think that one of the things we're learning right now is, particularly in our direct services to young families and moms and babies, is that some of the things we can do with either telehealth or just by phone are, we're learning really new things. We're doing the WIC program, Women, Infants, and Children Nutrition. We're doing that by audio and video with families. And so I think we're going to learn some new strategies that'll be good for the community.
From Heather, are we planning to move people around to different parts of the state for hospitalization, Patty, if if we become overburdened here? This is similar to France, apparently. This is from an audience question.
Right. So luckily, the hospitals here have a great organization that helps them in the region. And that response network is right now planning with all the hospitals in the Puget Sound region for how to move folks around if need be. They're looking at what the hospital capacities are, how to share that information. How do they look at what hospitals have the largest number of intensive care unit rooms? So what we know is really good for people is to be as close to home and family as possible. So my hope is that regional network of hospitals and working with public health, we can keep people close to home. And particularly, as Executive Constantine has said, if we're seeing a bending of the curve, the strategies that everybody is coming together to help us with, hopefully we can manage that close to home.
Dow Constantine, also from the audience, can we get an update on how King County is heading off the virus spread in the homeless population?
Yes, I mentioned a little bit earlier about this de-intensification. The first strategy was to simply find additional congregate facilities so people could be more spread out. We're now shifting gears a little bit toward trying to find individual rooms for people and to have those facilities still managed by whoever is managing the shelter. So if you have a shelter, it's a congregate setting. We will try to get a hotel or an apartment building, something that's available where they can move people into individual rooms so they won't infect each other as readily, but it can still be managed by one of the nonprofits with whom we work. The city has done a good job of finding space. We opened up Arrivals Hall at Boeing Field to move people out of a shelter that caters to older and sicker adults. We are working nonstop to try to prevent the virus from taking hold in shelters, and we are having little outbreaks here and there, and trying to get on them immediately with testing and with separation of people. And we're working on another one of those right now. And this is why we need these facilities to be able to move folks who are endangering others, who might infect others, into a spot where they won't do that. And then you've got the entire homeless community that is not in shelters, and that is an entirely different challenge, but one that the city of Seattle and we are taking on as best we're able.
Patty, I wanted to ask you one question that I definitely wanted to get to before we wrap up here. I was talking to a friend, a scientist, who provided sort of a new worry and a bit of hope all at the same time, because viruses mutate. And so I wonder how, and if you're prepared for the possibility that this virus could mutate and get stronger, or it could mutate and become weaker.
Well, both of those are true, and that's why we work as a network across the whole globe to work with scientists that are actually working with the virus in the lab right now to watch how it's mutating, to watch whether or not people can develop coronavirus again. This is one of the concerns as to why we really need to keep with the community mitigation strategies and the physical distancing. Is if we're not careful, then we can have a resurgence. And if the virus mutates and is stronger, the resurgence can be very overwhelming, particularly if this becomes a seasonal problem. So I'll leave that to the scientists to look at that and let us know what we need to do. But for us, we want to be prepared to help the community no matter which way this virus goes. And I hope it will mutate to be less virulent.
Dow, this is just on the sort of the political coordination, I guess, in our city, our county, and our state. I've been told from some of the other folks, other city folks, that your staffs speak to each other pretty much several times a day during this crisis. As you know, the World Health Organization recommends speaking with one voice to avoid public confusion. That's the danger there. So how have you folks been able to maintain that approach while the states and federal government, in some cases, not so good?
Yeah, I mean, I think that's a real important, if behind the scenes, success story here. We immediately, and we started planning for this back in January, set about to figure out how we were going to work with the governor and the State Department of Health, me, my authority as executive, and our public health agency, the city of Seattle and other cities, and then with our partners in the community, the hospitals, the philanthropies, business community. And people almost across the board have figured out how to check their political baggage, how to leave the axes they grind at the door, and to come to this with the seriousness that it really deserves. And one of the first things we all decided was that we needed to, regardless of who has the authority to do what, be able to speak with one voice and have the governor announce the steps that we're going to take and have them be uniform statewide. And I think we've done a good job of sticking to that. Now, that doesn't mean that people don't have egos. That doesn't mean people don't have agreements. That doesn't mean people don't get on each other's nerves sometimes. But the fact is that people have, I think, done an admirable job of stepping up to this, of rising to the occasion. And that is true of our city governments across the county, the local governments across the region, and the state. And as far as the national government goes, I can say that our congressional delegation has done great work, and I'll leave it at that.
I just want to, one last question from the audience here, and this is probably for you, Patty. As we get PPE shipped into our region, do we have an effective system of getting this equipment to the facilities that need them? And will there be any challenges of maintaining adequate supplies of PPE? We've had challenges on all the equipment so far.
That's correct. So there is a shortage of PPE, even for the folks like first responders and long-term care and hospitals where we know we absolutely have to get PPE. They're in that tier 1. We cannot fulfill all the requests. The State Department of Health is working with us to centralize that so that it gets out in an equitable way. But on the other thing, everybody needs to work in this system together. All elected officials in public health is just banging the drum, because in the very beginning, the federal government was not allocating this in a methodology that gave King County their fair share. That, because of our great congressional delegation, got altered, but we're still in a bad situation.
So I have to kind of cut it off there. We have such a great and large audience for this. So folks really wanted to get together and talk. Virtual Civic Cocktail, how about that? Many thanks to our guests, King County Executive Dow Constantine, restaurateur and businessman Tom Douglas, and Health Director Patty Hayes. Special thanks to Town Hall Seattle for producing this show. And thanks to all of you who joined us tonight. See you at an in-person civic cocktail when it makes sense to gather again. Good night.